Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. You are watching a special topics video for the Knee Range of Motion Blueprint, taking you from your day of surgery, of knee replacement surgery, to achieving your full potential of knee range of motion, bending, and straightening. This special topic video is going to talk about modalities, some of the common modalities that you may see or you may use when it comes to your physical therapy and rehab after knee replacement, and how they might be beneficial in your goal of achieving the most range of motion possible. So what are some of the reasons that we use these modalities? So the big one is going to be for relieving pain, relieving symptoms of stiffness, tightness, discomfort, pain, all of these things, and improving your ability to tolerate different activities, obviously different range of motion, stretches, and mobility exercises. That's the main reason. Also, some of these can be used to manage swelling and reduce that and improve comfort as well. And then there's one specifically type of modality that we'll talk about that is beneficial for helping to have a strong muscle contraction, which can be particularly useful for your knee extension or knee straightening range of motion. So now I'm just going to review some of the most common modalities out there. So obviously ice is extremely important, extremely common to use after knee replacement surgery. So a lot of reasons you're going to use this. Big one is going to be pain relief. So decreasing that pain, decreasing the sensitivity of the knee, managing swelling and inflammation, and just being able to use that then to tolerate things. So ice is something that I wouldn't use it necessarily before a treatment, but I would use it after doing your exercises or after a treatment session of physical therapy, and then kind of using that ice as a recovery method. Use it after you do a lot of activity, maybe a lot of range of motion activities, using that ice, calm things down, decrease some of the swelling, some of the inflammation that might occur because of working on the knee for that much. And then ideally that will help you to recover a little bit quicker and then be able to do some more range of motion activities and exercises later in the day or the next day, whatever that may be. So ice is a really big one. There's also heat. And some people, there's that debate out there. Should I use ice? Should I use heat? I would say just real briefly, I use both of them, and it's beneficial to use both of them for different reasons after knee replacement surgery. So heat can be really beneficial prior to doing a lot of your exercises. So especially if you're really going to be working on your bending and your straightening and things that are going to really kind of cause some aggravation, it might cause some pain and discomfort. I like to use that heat for some people prior to doing all of that as a warm up, get some blood flow, decrease the pain and discomfort, decrease some of that stiffness, and just be able to tolerate some of the activities that you're going to do after using the heat. You can also use heat a little later on in your recovery, just as a recovery type of method. If you're about to go to bed, you can put the heat on. If you're just in the evening watching TV or whatever you may be doing, you can use a little heat just as a pain relieving method as well. Next thing I want to talk about is transcutaneous electrical nerve stimulation, or more commonly known as TENS. So TENS is a form of, like it says, electrical stimulation. So you're putting the pads around the knee joint and you're connecting them to either a handheld or a little bit bigger device that's providing this controlled electrical input to the knee. Kind of gives you this kind of tingly pins and needles sensation in and around the knee joint. Really helpful for pain relief. So something that can be used before doing your activities and exercises to just calm things down and you can tolerate them a little better. Something to use after treatment so you can decrease some of the pain and use it as a recovery. And then also something, again, just to use kind of throughout the day as you recover. If you're have already had your physical therapy, already done some exercises, and you're just relaxing or at work or whatever it may be, you can just throw the TENS unit on, help provide some pain relief, help you recover a little bit so you can get back to doing some of those activities a little quicker. Then a similar thing, and this is the one where we talked about for muscle contraction. So this is known as neuromuscular electrical stimulation, or NMES. So same exact idea as the TENS. So putting the pads on and putting that electrical input into your body through your skin. In this case, though, instead of for pain relief, the point and the focus or goal of this is to provide a muscle contraction. And specifically, most of the time, it's for your quadricep muscles of your thigh, especially after a knee replacement or really after any type of knee surgery. This can be used and is common to be used. And so as you see with the pads, they're in a little bit different location. They're at these 2 points on your quadricep muscles of your thigh. And the parameters of the electrical stimulation unit are set in a particular way that they're going to actually facilitate a contraction, so a twitch, as well as can be a full contraction or tightening or activation of that quadricep muscle. And as you activate that quadricep muscle, its purpose is for knee extension. So if you activate those muscles, then you're going to end up extending or straightening the knee. And so it's can be beneficial, one, for building strength and building back the contraction of the quadriceps after surgery. And additionally, building back that knee extension and knee straightening range of motion after surgery as well. I also put in here ultrasound. I'm not a huge fan of ultrasound. Some therapists use it, some stay away from it completely. It is an option. It can potentially provide some pain relief. It can speed up healing a little bit. So something that I wouldn't necessarily make the main focus of my treatment, but something that may be used just as a pain reliever, help desensitize the area a little bit before doing your range of motion activities and exercises. But some people it's helpful, some people not as much. There's kind of a lot of mixed reviews out there with ultrasound. And the last one I put in here, just because it's growing in prevalence, growing in popularity, is laser treatment or cold laser therapy. Similar idea to ultrasound, but basically providing that laser in and around the knee joint. It's going to make some changes to the cells and the cell metabolism and healing of the cells, potentially some pain relief. Again, there's kind of mixed data out there. There's a lot of stuff that shows good potential and good benefits of this, but I think a lot of times it's person dependent. And again, it should really just be an adjunct to the exercises and everything you're doing physically and actively as part of your rehab and improving that range of motion after surgery. But can be something that's used for a pain reliever, improving healing, desensitizing the area a little bit better so that you can tolerate then doing those knee range of motion exercises and activities a little bit more. And that's really the case with all of these modalities. Is they're not going to be the main purpose of your treatment and your therapy, but they can be used kind of as before your active exercises and therapy, or at the end, or kind of when you're not doing therapy and exercises, just as a way to manage pain, to maybe speed up the healing a little bit, but kind of manage pain, improve your tolerance to both therapy and daily activities and things that you're doing day to day, and can be beneficial if used appropriately and adjacent with the other active exercises and therapy that you're doing. So this has been the special topic on modalities, again, with the knee replacement, knee range of motion blueprint. Thank you very much for watching.